This has been a passion to get to run a facility where at least you as the decision maker, you're able to do things which you will want to actually achieve towards standard healthcare for the people, things that can also bring happiness to the community, not just by treating, but also by reaching out in so many aspects of primary healthcare that is generally supposed to ensure that there is wellness in the community.
He is a Shujaa and a visionary medic. At 31 years old, Dr. Omweri Ombonye is already in his own class, contributing to the health sector in Bungoma County through his top-notch private hospital.
The hospital is actually currently offering fully fledged services, I can say. If we may classify ourselves as a level 5 facility where we are giving all the outpatient services, and most recently we are happy to have opened our Doctors Plaza, which has 17 specialists on board. Okay, so that means we are attending to all the cases that you can think about.
Yes, the alumnus of Nyamagwa Boys High School in Kisii is the founder and director of Hopkins Crescent Hospital.
I went to Kenyatta University. That is where I did my undergraduate in medicine and surgery for 6 years. Machakos for 1 year internship. High school, I was in St. John's Nyamagwa Boys High School, and that is in Kisii County. That is where I was born and raised before we moved to Trans Nzoia. And part of the reason why I'm now close to home, Trans Nzoia, that is part of the motivation as to why I started to run a hospital in Bungoma County.
Dr. Omweri worked partially at Kenyatta National Hospital before starting his own. This gave him the experience of how to run both inpatient and outpatient services of a hospital.
In the outpatient, we also give dental, optical services, all the radiology services, and then special clinic services including neurosurgery, dermatology, orthopedic surgeon. We have 2 orthopedic surgeons who normally offer their services in 2 days of the week. We have a plastic surgeon who is currently running clinics and also surgeries in the hospital. We have a urologist who attends to male and female urological issues, general surgery cases, pediatric cases, gynecological cases, yeah, and of course physician cases, which are general. So in the outpatient, basically we are running everything. All the laboratory investigations are also being run in Hopkins. We carry out about 98% currently. Our lab has moved to one of the highest levels of the laboratory, and we are on our gear to get ISO certified in the laboratory. And I hope, God willing, in the next 6 months we shall be ISO certified in the lab.
He founded the hospital in November 2020. This has since grown up to 87-bed capacity. The facility has employed over 102 people.
We run maternity services as well. We have newborn unit services, HDU services, all the high dependence unit services. ICU was also launched 4 months ago. We are running 4 beds in the ICU. And in the next 1 week, our dialysis will be up and running with 7 beds. We also have full comfort inpatient care for presidential services, commonly known as the presidential suites, for clients who want or who may feel presidential.
And what about referrals?
In case we do not have certain services, because of course health is very dynamic, our referrals are done to our neighboring facilities like Life Care Hospital. We can also refer to Moi Teaching and Referral Hospital, especially for oncology services. I think basically we only have oncology services that we are referring out, but all the other cases are being attended here. You realize Hopkins is also now a referral hospital. So we receive a lot of referrals from neighboring facilities and facilities from Busia, Kakamega, Vihiga, and Trans Nzoia as well.
Hopkins Hospital is a game changer in response to common diseases in Western Kenya. Screening and treatment of diseases is all done here. Samuel Dea is a medical officer at this facility.
So in Western, given where we are, we treat commonly malaria, we treat sickle cell disease, we treat what we call acute gastroenteritis, just diarrheal diseases. We treat also other conditions that are found elsewhere like meningitis and a wide range of others, psychiatric conditions like bipolar, schizophrenia, mood disorders. We equally offer dialysis services and laboratory and imaging services. So in our imaging services, we offer X-rays, CT scan, echo, ECG, and then we offer also a wide range of laboratory procedures that our patients may need. Yes.
Malaria is a major cause of morbidity and mortality in Western Kenya, with more than 70% of the population at risk. This is according to World Health Organization report. Large water bodies such as lakes and high forest coverage provides breeding sites for malaria parasites.
Currently, the statistics are that around 20% of patients that are managed in the outpatient are managed with malaria. Yes. And Bungoma, currently the numbers are high. I think currently under 5 is around 18% positivity rate. Out of 100 people you test for malaria, 18 will have malaria. For above 5 years, I think is around 25%. Out of 100 people you test for malaria, 25 will have malaria.
Children below the age of 5 years, the elderly, and pregnant mothers are more prone to malaria attack. Also in the list are patients who are on cancer medication and those who have other medical conditions. Their immunity is low and therefore are at more risk of getting malaria.
Malaria is not seasonal, it's there throughout the year, but a lot of time it's found during rainy seasons. You can control the vector, you can give some vaccines. Of course, there's a vaccine that is on trial. For malaria. There's a pilot that is currently ongoing, I think in Kenya, Malawi as well. And there are good reports from the same. You can control the vector by clearing the bushes as well.
Malaria is closely followed by sickle cell anemia, a group of inherited disorders that affect the human hemoglobin.
Bungoma relatively has high numbers of sickle cell disease. Currently, out of 100 people that we test for sickle cell, 20% have sickle cell disease. The other 80, part of them have the trait. Those who have the trait are those who have one abnormal gene. If you have one abnormal gene, you'll be otherwise healthy, but then have the mutant gene.
What is the next course of action should this be the case?
Of course, there are things we can do. You know, we are talking about two parents coming together and then transmitting the condition to their offspring. How about if, for example, I got married to somebody who doesn't have the mutant gene? You understand? So that is why currently the advice is that before you settle with someone, you'd want to know, do they have the trait? You know, like I can get married to a lady who is otherwise normal, but has one mutant gene. So if equally I have a mutant gene, then our offspring may have the condition. So then genetic counseling and genetic testing may help us to at least lower the prevalence of sickle cell disease. But if we don't, then under 5 mortality comes in. We lose them before they get to their 5th birthday. Yes. And their numbers are increasing because people are not doing genetic screening and getting to know their genetic makeup, whether or not they have traits. If we were to do that, then we would reduce the prevalence and the incidences of sickle cell to a larger extent.
Samuel says that most babies who are born with the sickle cell disease die before the age of 5. And this is because of inadequate care, lack of knowledge, and late diagnosis, among other reasons.
If we make our diagnosis early, the child is followed up in the pediatric clinics with the right healthcare workers, then they can live up to 50s and beyond. But if we are not followed up in a clinical setup, or we are diagnosed late, then we may as well diagnose you with this condition when already you're having complications. Because now the sickle cell essentially affects literally every organ. Babies will come with low blood volume, they'll come with acute chest issues like chest pain and all that. They are prone to infections and all that. So if they are clearly followed up in the clinic and diagnoses are made early, they can live up to their late years.
Genetic screening and counseling is important for those in courtship and are planning to have children who are sickle cell free in their marriage.
If I am normal, I may be carrying the trait. If I get married to somebody who is equally normal and has the trait, there's a 25% risk of giving birth to a child who has sickle cell. A 50% chance of giving birth to a child who has the trait, and a 25% of chance of giving birth to a child who is normal. So that we don't get there, I would rather I go for genetic testing. I know my sickle cell status. If it's okay, then I can proceed. If it's not okay, then I would rather get married to somebody whose hemoglobin is okay.
And these are other areas of concern.
I think it's a matter of public health concern. We are increasingly having patients with head injuries, fractures secondary to road traffic accidents, and mostly due to accidents involving motorcycles. And a lot of time there are patients who are having serious injuries, like serious brain injuries. Some may end up having permanent complications.
Dr. Samuel Dare is very confident that Hopkins Hospital has enough medical equipment and rich pharmacy to timely respond to their patients' needs. He, however, has a message to the community.
I think it's important that every time we have an health issue, we seek care. Because most of the patients we see, they come in their later stages. For example, I gave an example of a case where we are managing kids for acute gastroenteritis, diarrheal diseases. For our children, one of the things you don't want to really waste time on when your child has is diarrhea. The other one is vomiting. The other one is fever. So anytime you have a child who has fever, has vomiting and diarrhea, you want to seek care immediately. Because if you don't, you'll bring your kid when he's severely dehydrated. And at that time, even getting a vein to have the medication seen will be a problem.
Hopkins Hospital is organizing the first ever wellness run in Bungoma County to take place on 10th November 2024, a marathon of about 10 kilometers.
We've also organized sickle cell awareness talks, drives to help with blood donation, football tournaments, supporting one of the soccer Division 2 teams, which is the Bungoma Stars team. It is one of our mandates that we are providing. We'll also have pregnant mothers to walk for about 800 meters and back to the hospital. So the championship of this is to help in reducing the risk factors that contribute to cardiovascular conditions, metabolic conditions like diabetes, of course cardiovascular conditions like hypertension, and the sequelae which you've seen present in a manifestation that is not good, like stroke. So those are some of the things that we want to encourage people to involve themselves in, to reduce sedentary lifestyle, and at least to come to hospital, never to wait until they're so sick, to come and have their sugars checked, to have their blood pressures checked, so that in the event that there is a sickness that can be picked early enough, then we can have these people to benefit from this healthcare.
And with that, we come to the end of today's show on your home of informative and inspiring stories. And that is the spirit of the Chamwada Report. Until we meet again next time, many thanks for watching.